Now, I wanted to ask the difference between low, moderate, and high intensity exercise. For someone who isn't necessarily an athlete or might not know like the general differences of those, could you explain them? And then could you explain how each of those affect you after a brain injury?
Yeah, so if we wanted to use the percentage of heart rate maximum, so 220 minus your age, and then whatever that number is, a percentage of that, low intensity is going to be somewhere between like 55 and 65% of your heart rate max. And so when we're looking at like cardiovascular fitness, 65% is kind of the minimum threshold that we want before we're going to see cardiovascular fitness changes. So low intensity is really low intensity. It's like the bare minimum for you to get a cardiovascular benefit. Moderate intensity is going to be 65 to 75% of your heart rate max. And then high intensity for most people is going to be anything above 80% of your heart rate max. So even if you're a young athlete, if you're clipping at 85, 86% of your heart rate max, you're moving. Like that's pretty intense. And so then what we look at, there's not a whole lot of evidence. I shouldn't say not a lot of evidence. There's not a lot of research in actually putting folks with concussion or PCS through high intensity protocols, just because the tolerance isn't there. Like no one would be able to do it or complete it. And so when we're looking at the data for lower and moderate and high intensity, we're either looking at data from healthy controls, so people without concussion, what does their physiology do under these circumstances? And then we're looking at the Buffalo concussion treadmill and bike and CO2, O2 gas exchange studies in these concussion patients. And so when we look at low intensity exercise in young, healthy, active folks, low intensity exercise doesn't seem to adversely affect brain blood flow. It doesn't adversely affect cortisol. It doesn't adversely affect, we haven't talked about this yet, but brain-derived neurotrophic factor. So BDNF, it's this little molecule that your brain will shoot out. I've heard some people call it like brain miracle grow, but it's kind of a plasticity molecule. So more BDNF means better synaptic connections, better dendritic connections, better neuroplasticity. So low intensity exercise doesn't affect blood flow, doesn't really affect cortisol, doesn't really affect BDNF. And the reason we talk about cortisol is because high levels of cortisol will actually impair BDNF function. So high levels of cortisol will impair neuroplasticity. So within low intensity, we don't really see any changes. When we get to moderate intensity activity, we actually see positive effects on brain blood flow, positive effects on cortisol, inflammatory loads, and plasticity, BDNF. And there's variable changes in blood pressure and autonomics, but overall moderate activity seems to be really good for the brain in young, healthy folks. When we get to high intensity exercise, and I'll throw a little like soapbox note or like caveat note at the end, but when we get to high intensity exercise, that's when we see increases in blood pressure and variable changes in blood flow. We see increased free radicals, so increased like oxidative stress, increased cortisol, decreased brain glucose because your brain is using up all that sugar, and there's notable changes in the blood pressure to your brain. So high intensity exercise essentially causes a decrease in brain fuel, altered brain blood pressure and brain blood flow, which is stuff that just wouldn't be tolerated after a concussion. But what I will say is the caveat that I want to say is when we look at high intensity exercise versus low versus moderate, we see that low and moderate have these good brain effects. And we look at high intensity and we go, oh, well, there's increased oxidative stress, there's increased cortisol, there's altered blood flow. That must be bad for your brain. That's not true either. It's just context specific. So I wouldn't give someone with concussion PCS a high intensity interval like Tabata program during their recovery. But eventually I would love for someone to be able to tolerate that because it means they've got great autonomic recovery. It means that we can tolerate these changes in blood flow and these swings in blood pressure. And it means you're probably doing pretty well after a concussion if you can tolerate these high intensity exercises. So I will say it's context specific, but low intensity, moderate intensity seems to have really positive effects on blood flow and plasticity and the stuff that we want after concussion for recovery.
That's great information. And I want to say for those out there, low intensity doesn't mean worse or, it doesn't mean like low, moderate, or high intensity.
Yeah,
you don't
no,
think
it's
that
not.
because sometimes you might feel, oh, all I can do is low intensity or, and not everyone is going to need to or want to do high intensity workouts. What I'm hearing is that doing low and moderate is like really better for your brain as far as the recovery.
Yeah, absolutely. It's better for your brain as far as the recovery. And then, I mean, for the athletes out there, when we look at, I mean, marathon runners are an extreme example. When we look at a lot of athlete programs, especially with more like some of the newer science on recovery and the newer research on what we know about autonomics and sports performance and different things like that. If you were to do Tabatas every single day, you would crash. You can't do high intensity for very long. So when we look at like training programs for athletes, a bulk of their program, like the vast majority of their program, is done in these kind of low to moderate intensity areas with swings into this higher intensity area. So unless you're very, very specific athletes, I'm thinking like MMA fighters where you just need to explode all the time, or even hockey players have a good mix of aerobic, kind of lower intensity stuff thrown in. But for the most part, even elite athletes are not doing gobs and gobs of high intensity work. A lot of it is low, moderate intensity work, because maybe not the context for this podcast, but it is the foundation for recovery. Your aerobic capacity determines how much you can lift and how fast you recover between resistance training sets. It determines how fast you recover between the high interval sets. So that low to moderate intensity work is really, really important, even if you are an athlete, were an athlete, or just recovering from concussion. It's really important stuff for your body and your brain.
That's great. So can we talk about resistance training?
Yeah. So generally, in the context of concussion, one of the things we don't like is that or I should say we don't like early and like acutely, is that there's when you have to contract particularly big muscles, so if you're thinking like squats, deadlifts, bench press, where you've got like Valsalva maneuvers happening, you're actually constricting blood flow back to the heart. And so you have this compensatory rise in heart rate. So people who think they're doing cardio when they're weight training because their heart rate goes up, you're actually not doing anything to improve your cardiovascular fitness unless you're like a couch potato. But if you're kind of like an average fitness individual or like an average kind of healthy individual, strength training is not going to change your VO2 max. It's not going to change your cardiovascular fitness. That heart rate is just a response to the fact that you constricted blood for a long enough period of time that your heart had to figure out how to maintain blood flow while that blood was missing. So the heart rate compensatory response is going to go up. We see increased oxidative stress. We see decreased vagal reactivation. So after like a heavy strength session, if you're someone who tracks your heart rate variability or your HRV, you'll see that after a strength session, it might be the next day or the day after, that your heart rate variability actually drops because you're still sympathetic from that training session. So we see increased sympathetic activity, increased cortisol with resistance training, and it tends to be at specific percents of your 1 rep max. So similar to the heart rate max, in strength training, we use 1 rep max for easy numbers. Let's say it's 100 pounds. So if someone's 1 rep max for a squat is 100 pounds, it means that if we put them under a 100-pound barbell and we have them squat, they could only do 1 rep. It is their 1 rep max. And so then we work off percentages of that. And so when we look at brain blood flow, once we get above like 60% of a 1 rep max, we'll start to see changes in blood pressure and changes in autonomics that are enough to disrupt brain blood flow and increase cortisol and do all the things we don't want. So there's not a ton of research on like the acute and the post-concussion like resistance training. So a lot of what it comes down to, there's a doctor, a great doctor on Instagram. I think her handle is Thrive Neurosport. But Dr. Katie Mitchell, she's a physical therapist, PhD, and she talks a lot about with resistance training. It's not just strength training. It's not just resistance training. It's context. Like, why do you need that movement? Why do you need that resistance training? And then it changes your view of, well, I need to lift really heavy just because that's what you're supposed to do. And it changes it to, how can I get my body to tolerate the demands that I need it to have for my day-to-day life? So that could be as simple as holding your kid that keeps interrupting the podcast, or different demands of your life, carrying groceries, different things where resistance training might be useful. And so that's where lifting heavy may not always be the goal. But then when we look, going back to the percentage of 1 rep max, if you stay below 30%, we don't tend to see those changes of blood pressure, blood flow, autonomic changes. So if that person's 100-pound one rep max, if they were lifting 30 pounds, it would feel really easy, but that's something they could do that likely wouldn't impair symptoms, impair recovery in any significant way. So it's kind of a long-winded ramble, but resistance training has, when you're doing kind of heavier resistance training or like moderate resistance training at weights that would keep you kind of at like a very classic 3 sets of 10 reps kind of scheme, that's going to have these oxidative changes that are good for muscle growth and that are good for strength, but not so great for concussion, not so great for concussion symptoms. So you really want to think about the context in which you would need that strength. And then you want to start low and go slow, similar to aerobic training. So starting your resistance training kind of at that 30% of your one rep max, if you know what that is, and you want to train within the context of what you need, not just lifting heavy to lift heavy, unless that's what you do. If you're like a bodybuilder, you need to lift heavy to lift heavy. But for most people, it's just finding the context in which you need the strength. Even for athletes, it's finding the context in which you need the strength and then starting low and building from there.
I think that's so important, and mindset on it as well, realizing, you're doing this for your health, especially after concussion recovery. And I love the way that you explained how it affects your brain. So your general idea is thinking, oh, well, if I lift heavy, that's better. I'm stronger. But in reality, you don't want to push it so much that your brain is adversely affected. And so realizing, hey, you might want to lift lighter, but it's going to be better for you in the long run. Is that right?
Yeah. Yeah, absolutely. And then within that lighter, like say you're having vestibular or proprioceptive challenges, maybe you're not lifting heavy, but we're having you do head or eye movements while you're doing the exercise, or maybe we're having you do something on a single leg, or having you do something where there's this vestibular and proprioceptive demand. So you're moving your whole recovery forward rather than just focusing on how heavy can I lift. You're moving that whole needle forward, not just the needle of strength training.
That's great. So can we talk about duration of exercise as far as how long you might do an exercise session for? Does that make a difference as to how it affects your brain, especially after a concussion?
Yeah, it does. And this again comes from like the healthy non-concussed research, and it comes from the like just overt intolerance to certain durations. So when we're looking at prescribing exercise after the Buffalo concussion treadmill test or after the Buffalo bike test, it's typically we recommend folks, hey, I want you to do 20-minute or 15 to 30 minutes once a day. So if you can tolerate, say someone's deconditioned or there's some obesity or something involved that's limiting their movement, we might say 10 to 15 minutes. But for the most part, the recommendation is 10 to 30 minutes, 15 to 30 minutes a day. Once we start to go above 45 minutes, then your body kicks in a whole bunch of mechanisms to say, whoa, like this is real. Like we're really moving here. Like something's happening, because 45 minutes is a good amount of time. And so what we see is there's increased oxidative stress, because for the mitochondria in your cells, so high school biology, the mitochondria, the powerhouse of the cell, for those guys to produce energy, they also produce free radicals, and there's an oxidative stress component to producing energy. So when you have to produce energy for 45 minutes or longer, there's more oxidative stress. You need to mobilize some more blood sugar, and the hormone you use to do that is cortisol. And so that might impair some neuroplasticity. We see that at that long of a duration, we start to see altered changes in blood flow. At that long of a duration, we also see that you start to use up brain blood glucose. And we also, with the shift to cortisol and with that shift to needing to keep going, we see this shift towards this fight or flight sympathetic predominance, which again ties back into the blood flow and ties back into the symptom experience. So like in people terms, it has the potential for more like neuronal damage, more impairment of plasticity, and reduce kind of availability of brain fuel, which is already kind of at a deficit, especially acutely after concussion. So we like to keep sessions for sure. Like I've had a couple triathletes that were like, oh my God, I can only work out for 20 minutes. And so I was like, you can try to push it between 30 and 45, but please don't go longer than 45. And these like elite triathletes were like, yeah, I tried 45, 50 minutes and I felt like garbage. And I'm like, yeah, absolutely. So this is where it's one of those, you got to slow down to speed up. Like we had that conversation of, you got to slow down to speed up. Like if you want to get back to your regular training, we need to make sure that your brain can tolerate these changes in blood flow and changes in blood pressure. And the way we're going to do that is kind of these 30-minute increments until we get back up.
Through your darkest night, hope survives.